Welcome back. In this video, we're going to work our way through the PowerPoint in a bit more of a logical fashion. Now that you have an idea of the basic structure of the heart and how blood flows through the heart. Here we can see on PowerPoint chapter 20, slide number 4, right down here, we see the basic orientation of the heart. The heart sits atop the diaphragm. Remember that the diaphragm divides the thoracic cavity from the abdominal cavity below. And if we look at this little inset, we can see that the diaphragm and the heart are actually separated by a few layers of tissue. There is a plastic wrap-like structure, smooth serous membrane called the visceral pericardium that wraps the heart. So you could visualize this like, what if you bought a big chunk of meat in the store and it came vacuum sealed? That's somewhat like what your heart would look like inside of the pericardium, the visceral pericardium. We'll find out in just a little bit that there's also an outer layer called the parietal pericardium, and we'll see what happens when those two are interacting. We also see that the heart is sort of smushed right in between the lungs. The heart's beating, boom, 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 and I'm breathing. Why don't I get calluses or adhesions? Why doesn't my heart ever start to stick to my lungs? Well, it might sound like a silly question. The reason that never happens is not only is the heart surrounded in a slippery double layer of plastic wrap-like tissue, but the lungs are also wrapped in a double layer. So there are actually 4 layers of tissue and some slippery fluid in there, separating the lungs from the heart. It makes for very efficient breathing and heart beating, for lack of a better term. Okay, a bit confusing. This seems counterintuitive, but the apex of the heart is at the bottom and the base of the heart is at the top. Why on earth would they design such a weird system? Well, I guess they thought it looked a bit like a triangle. And so you know from geometry that the pointy bit of the triangle is the apex, and the broad base, well, that's the base. Your heart is an upside-down triangle with its apex pointing down towards your left front pocket. Just above the base of the heart, inferior to the larynx, the voice box, and medial to the lungs, we see this region right here, the mediastinum or mediastinum, tomato, tomato kind of thing. The mediastinum is this cavity that contains the great vessels, and the trachea, the esophagus, is just behind that. So not a fluid-filled cavity. Everything's just sort of jammed in above the heart, between the lungs, and in front of the respiratory tract. And so that region there, the mediastinum, central core of the thoracic cavity. All right, here we see a superior view. One of the things I like about my job is testing my visuospatial skills. We have to imagine that we've sort of chopped through our patient and removed the top part, and we're looking straight down. A superior view means that you are above looking down. Here is the spinal column, right? There would be the spinal cord. Here are the vertebral bodies. Here's the esophagus, lungs. Look at the lungs really wrap all the way around, quite nearly, except for the sternum right in the front, and the vertebral column immediately posterior. Think about that as it relates to CPR, ladies and gentlemen. Good chest compressions have to be smushing the heart in between the sternum and the spine, sort of that straight line right there. So anyway, looking down, we can see some valves. We can really appreciate those 4 tissue layers, the pericardium and the pleura. And then I've helped to set those words out for you just a little bit there. Here we can see a different perspective and lots of words, lots of detail here. Yep, pretty much need to know all of that. Hopefully it's very straightforward. Let's talk just a little bit more about the histology of the heart. The heart is made up of several different tissues. The most important is the meat, the myocardium. This is cardiac muscle tissue. and your heart is, I don't know, 90% by mass myocardium, something like that. It's very meaty, a very meaty organ. Not surprisingly, it is a muscular pump, right? That's why it is so meaty. The inside, this endocardium shown in blue, this is the non-stick coating. Simple squamous epithelium that provides something like a Teflon coating, prevents blood clot formation, and keeps the blood moving through without forming a big thrombus. The outer layer here is called the epicardium, and it is the visceral pericardium. Very strange, but histologically, it's epicardium. This is also simple squamous epithelium. Not uncommon, especially in older adults, to see some epicardial fat. We see that when we do dissections even of our sheep hearts. And those sheep aren't eating cheeseburgers and french fries like I do. But anyway, that's a different topic. Let's see, what else do we see? The trabeculae carneae are these big meaty ridges that we see on the inside of the heart. We see them also in this picture here. Capillary muscles are attached to the tendinous cords, those safety lines. But all of the other sort of meaty, chunky wall sort of looks like lava in this particular picture, or fire. That's called trabeculae carneae. Now, in the atria above, we see something. It isn't quite very apparent in this particular picture. We see something like the trabeculae carneae, but we call them pectinate muscles up above in the atria. Let's see. Next, we're going to talk about the importance of the coronary circulation. Lower your eyes, hold your breath, tilt your head, and imagine that this heart looks something like Jesus's head, and then the blood vessels look something like his crown of thorns. Well, that's what the early anatomists thought, and they spoke Latin or Italian, and so they called these the corona, the coronary arteries. Coronary means crown. Wow, it kind of does now that I look at it. It's weird. The coronary arteries are super important, of course, because they nourish the heart muscle itself. Now, wait a minute, you might be thinking. I thought that the heart was filled with blood. Why can't the blood in the chambers, like the ventricles, nourish the muscle here in the ventricular wall? Well, it's far too thick, right? We might imagine that the muscle cells right on the surface here may be close enough that they can be receiving some oxygen and nutrition through diffusion. But in order for the heart to really function properly, it must have its own blood supply. So look at this, quite strange. The very first branches of the aorta are the right and left coronary arteries. The right coronary artery comes down the right side and then branches. The one that goes around the back side is called the right circumflex, although I don't see it labeled here. The right circumflex, and then this one here is called the right marginal artery. In the three-dimensional heart model, you'll see there is a bit of an edge. It's not sharp, but it is right along the margin. In a very similar way, the left coronary artery comes off of the aorta, and then from positive blood pressure, blood perfuses through. Here's our left circumflex, our left marginal branch, and this most important coronary artery of all. In this particular picture, it's labeled the anterior interventricular artery, but in the real world, everybody calls it the left anterior descending. Okay, the LAD. Now, why is this one the most important? Well, recall that the left ventricle is the most powerful chamber of the heart, and it is the one that generates positive systemic blood pressure. And so in the event that there is a blood clot or blood vessel damage, some sort of occlusion, the blood will no longer flow to the muscle of the left ventricle. And that type of a heart attack is called a widowmaker because the fatality rate is so high. We'll take a closer look at that in subsequent animations. Finishing out this video here, let's look at the coronary veins. Just like the systemic circuit, my arm, for an example, has a brachial artery and a brachial vein, one to send blood and one to receive it. In the same way, the coronary circulation has arteries and veins. So after the oxygen and nutrients are used, the blood is recollected from the coronary arteries and then into these blue coronary veins, where they have to go back to the right atrium. Now think about that. Why is that the most logical chamber for this blood to go back to? Well, remember that the right atrium is receiving this low oxygen blood, this so-called used blood, from the rest of the systemic circuit through the vena cavae. It's logical that the coronary circuit should also empty into the right atrium so that this blood can be sent to the lungs to be re-oxygenated. Okay, so what do you need to know here? Small cardiac vein, great cardiac vein, and then the coronary sinus, which is on the back side of the heart. And then there's this tiny opening. You'll see this on your heart model. If you open up the hatch and look into the right atrium, it is on the wall, the interatrial septum, a tiny dark spot that we call the opening to the coronary sinus. A couple quick things. Coronary artery disease. This is a form of atherosclerosis, fatty plaque accumulation, that specifically affects the coronary arteries. And so look at this. Here's the widowmaker I was just talking about. Imagine, this is quite a stereotypical case, but let's just roll with it. Imagine a 50-year-old white male, overweight, smoker, high cholesterol. Over many years, his blood vessels have become clogged with plaque. This animation is just a little bit deceiving because it looks like the cholesterol is really right next to the blood. In reality, there is the endothelium wrapping that, but nevertheless, the blood vessel is diminished in its size and its ability to carry nutrients and oxygen to the heart. In the event that a blood clot forms right here, we can see the effect. Look at all of this muscle downstream from the occlusion. The blood clot is being starved. Very sadly, this type of a heart attack, this patient is often asymptomatic, and sometimes the very first symptom is death. Ooh, that's a very severe form of a myocardial infarct. Necrosis is tissue death, and this word is pronounced ischemia. Ischemia. This lack of blood flow can cause tissue pain and dysfunction. It's very much like what we see in a stroke, by the way. This here slide, our very last one for this portion of the video, so wake up. Here we go, very last one. Cardiocytes are attached both electrically and mechanically. Cardiocytes are heart muscle cells, and so if you look at this histological slide, you may recall, maybe you remember, maybe you recognize, I hope you do, that would be beautiful, that this is an intercalated disc, and this is the margin of one cardiocyte. Cardiocytes are striated, striped. They're branching, right? They're not parallel like we see in skeletal muscle, but you can see it's sort of twisted and sort of has wood grain look to it. One nucleus per cardiocyte. And this is really what I want to talk about. Those so-called intercalated discs are both electrical and mechanical connections. Now that is super important, and that's why I'm really slowing down and focusing here. The reason that we need to know that heart muscle cells are both mechanically and electrically connected is because they allow electricity to flow right through from one cell to the next. And that is really important for the heart to contract in unison. The other thing is they have to have very strong connections because they're contracting and relaxing all day long, right? Imagine if you were lifting your coffee cup up and down, up and down, up and down, 60, 70, 80 times a minute for your whole life. Man, your arm would get tired. And the muscle cells could begin to degenerate. That's not an option in the heart. And so nature has designed these extra special sturdy connections called desmosomes. The electrical connections are called gap junctions. All right, good place to pause the video. See what you can do describing these structures and answering the following questions.